What are the recent developments in diagnosis and management of chronic urticaria?
Chronic urticaria is recognized in approximately 1% of the population. This means hives lasting 6 weeks or more, and approximately 50% of these patients may have hives after 6 months, but only about 20% have hives at 10 years. So there is a long-term aspect of this condition, but it's appreciated that many people will actually lose their hives even if they have lasted for 6 months. It's worth pointing out that some patients have autoantibodies that are either of the IgG isotype, meaning the class binding to thyroperoxidase or thyroglobulin, and some patients have IgE antibodies to thyroperoxidase, which perhaps may be associated with mast cell activation. There's also evidence for activation of the contact system because D-dimer can be elevated in some patients with chronic urticaria.
How will the new developments in the diagnosis and management of chronic urticaria affect patients in the future?
The new development of demonstration of IgE antibodies to thyroperoxidase has been associated with the introduction of the anti-IgE omalizumab monoclonal antibody used for therapy in a number of countries, including the United States, but not everywhere. And there is interference with the process of chronic urticaria to a spectacular degree in that patients can start having fewer hives within 1 to 2 weeks. This is really a remarkable change from patients who have had hives for months or years.
What is your take-home message for allergists and primary care physicians?
Chronic urticaria causes interference with good quality of life, and patients need to be given some hope. One additional new aspect is the updosing of the H1 antihistamines, wherein up to 4 times the labeled dosages will provide benefit for some patients. And alternatively, if available, omalizumab can be administered, and one would expect reduction in hives within 1 or 2 weeks even, or over a few weeks thereafter. This is a very welcome addition to the armamentarium.
Where is the research in chronic urticaria heading in the future?
It is heading in the future in a way to understand the mast cell more carefully so that we would have some possible therapeutic targets. Right now, we are exploring the benefits of omalizumab and the welcome early onset of action with that modality, but we need other treatments as well.